As the coronavirus pandemic continues, we need to make sure to take care of our most vulnerable citizens. And I have been very concerned that there are not enough protections in place to keep COVID-19 from spreading among our homeless population. It's a group that often doesn't get proper health care and can have the kind of close contact that leads to the spread of the disease. And that's why today I directed the Health Department and the Housing Department to send out a team of nurses and medical staff who are right now visiting every one of our citizens in the 31 shelters and warming centers across the city of Detroit. We are checking on their welfare. We're going to take their temperatures, see if there's any signs of symptoms. I want to thank Detroit Rescue Mission, Highland Park Mayor Hubert Yap, and Superior EMT for their efforts on this. We have made arrangements that at each of the individual shelters, if somebody is showing symptoms, we can get them separated immediately, and then we will safely transport individuals we think are showing symptoms to a location where they can be separated until we can get the testing done. And so all of our homeless should be seeing our nurses and medical staff tonight and tomorrow. I want to thank Arthur Jemison for his leadership, and he'll speak to you in a moment about that. The governor, about 2.5 hours ago, shut down dining restaurants, but allowed for carryout. We want to support our business owners in this city as best we can. And I hope members of the public will frequent your favorite restaurant and come get carryout, even if you can't sit down inside. To facilitate that, tomorrow we will have a link on the city's webpage. If you have a restaurant that's got parking meters in front of it, where people used to pull up and park while they ate, you can petition to make it a curbside pickup zone. And for the balance of the restrictions on the restaurants, DPW will come out, make it a free curbside pickup zone so your customers won't have to worry about being ticketed. So I wish we'd gotten the link up today, but we're right on top of this. We need to stand behind our business owners. And it was unfortunate, some of the behaviors we saw over the weekend of people crowded into different bars and restaurants that really left the governor with no choice but to do this. It wasn't the fault of many of the restaurant owners who are now suffering or their employees. So you want a free drop-off zone in front of your restaurant instead of parking meters. Go online tomorrow, click on the link, and we will get on it right away. A couple other things I want to highlight that happened today. I want to thank Judge McConico, the Chief Judge of 36th District Court, who has temporarily suspended evictions proceedings at the court. This doesn't mean that your lease obligation stops, and if you can afford to pay the rent, please keep paying it. But the last thing we needed was people being put out on the street in the middle of this, and I think Judge McConico did a very good thing. I also want to thank Treasurer Eric Sabri, who has suspended the foreclosures for this year. And again, we don't need people being put out in the middle of this. And we got a lot of folks who would have been working where they not have sent home because of various business interruptions. But I want to say again, go on our website and fill out your poverty exemption form. An individual who makes less than $22,000 or a family of 4 making less than $32,000, go to the city website and sign up for the HP TAP exemption and the pays bill, because it will cut your tax payments next year. The sooner that you go fill it out, the lower your payment is going into next year. And so we had a lot of folks who were filling it out this year because they thought there was a foreclosure deadline coming up. The foreclosure deadline is gone, which is a good thing, but you still don't want to get that bill next year. And so those exemptions remain in place. One last thing that I hope the people of this city will do, as we are now sitting at home being socially distanced from our neighbors. But you got something in the mail, and it's your census form. And our future for the next decade is going to be determined by whether we fill this out. I filled mine out yesterday. It took less than 10 minutes to do. But if you think about what it means, Dr. Vitti and the Detroit Public Schools are continuing the school lunch program with their grab-and-go program during the period of time schools are out. That school lunch funding comes on a population basis based on the census. We've got folks in this town on Medicaid who have their health care to take care of them. That Medicaid money is allocated based on the census. Arthur Jemison just sent housing folks out to make sure every homeless person is being cared for during this crisis. Those homeless funds are allocated by the census for the welfare of our children and our most vulnerable for the next decade. Please take 10 minutes. It is really important. It's going to matter to the people who need it most for the next 10 years, and you're sitting in the house anyway. Take the time, do it online or mail it in, but it is census time, and the truth is, whatever cities fill out their census form in the highest percentage, get most of the money. In 2010, Detroit had the lowest return rate in America, and we probably lost $300 million in the last decade. How much would that have meant to us? We can't afford for our children and our most vulnerable to lose that again this decade. And with that, I'd like to turn it over to the leader of our housing and revitalization team, what they have done in a very short period of time. They showed me the new beds that they've opened to make sure we have enough space to be able to separate those with symptoms from those that are not. It's been great work, so I'll turn this over to Arthur Jemison.
Thanks, Mayor. I can answer any questions you have, but I want to thank my director, Donald Rencher of HRD, his homelessness solutions team member, Tara Windsor. Tara Defoe's been working with us on some other projects, crucially. And of course, the health team member who's embedded with us, David Bowser, who are out there right now at the site at Cass Community, participating in the temperature checks. So we've got teams out there. We've been working for the last 3 or 4 days to identify additional shelter capacity that would allow us to create a situation where people, if they were exhibiting fever or other symptoms, would be able to be separated. And so now we've had a series of webinars with each of the shelter providers. And so again, teams are out there today and tomorrow trying to make sure that people, if they do need particular and new attention, that we can get that to them. If they need to be separated or isolated, that we have places they can go to where they can get medical attention as necessary. We think that's an important part of making sure people who come to shelter, that shelter can be a real option for them, and people who have been in shelter can know that the people who need additional attention are able to get it. I can talk in more detail and answer questions about it, but it's been a 3 or 4 day effort. We've got, it's going to continue over this week, not just with the additional capacity, but trying to add even more capacity. So if we have more need, we have the ability to respond to it. But again, I'm happy to answer any questions you guys might have about our response in shelters today.
Mr. Jemison, before we do, let Denise speak, and then we'll take all the questions. Go ahead.
Okay, thank you. So our role at the Detroit Health Department is to protect the safety and well-being of all of our residents, particularly, most importantly, our most vulnerable, which is our homeless population. And I'm really pleased with the plan that the mayor had briefly indicated, as well as Arthur Jemison, and working closely with the health department. So these individuals will have a better opportunity to practice both the precautions that the mayor and I have been speaking about over the last several weeks. The center will have access to water, so individuals can wash their hands, resources to manage their symptoms, and better yet, get the care that they need. So as we continue to deal with COVID-19 and all of its implications, this is yet another intentional step that we can take to ensure that all residents are protected. We know nothing stops Detroit, so let's continue caring for each other by washing our hands, covering our coughs, avoiding large crowds, practicing social distancing, and of course, staying home when we are sick. Now, this advice may sound redundant, but it's the best defense that we have now. Again, thank you, Mayor Duggan and Arthur Jemison, for your leadership. Let's continue to work together as we slow the spread of COVID-19. And now we'll open it up for questions.
Arthur, ML has something he wants to ask you.
Sure, evidently.
Mr. Jemison, do you know how many homeless there are in Detroit and how many are in shelters and how many may still be on the streets for whatever reason?
Sure. We estimate that there's approximately 2,200 people. That's on the basis of the pit count trajectory over the last 5 years. We estimate that there's probably about 1,000 people in shelter today, maybe 1,200, and so that's the basis we've been working from in our estimates.
And what measures can be taken to reach the other 1,000 who may not be in a shelter because there's no room or because they just don't want to do it?
So what we've been doing is, and sort of part of the approach we rolled out today means that at every one of the touch points, not just the shelters, but also street teams, there's a street outreach portion of the work that cities contractors do, where they go to places that homeless individuals congregate. And so what we're trying to do now is go to shelters because that's the first place and people were in the closest contact and not outdoors. We're hoping to later this week expand so that we're able to have street teams and other points of entry go out and engage with people in the places they're located. So I think later this week we would expect that part to launch. But we wanted to start with people who were in shelter today because again they're in close quarters often, and we wanted to make sure that we started there. I mean, again, this is we're learning this along with lots of other major cities around the country about how to do this. And the first step we thought was let's go into shelters, get some diagnostic information, and if necessary, isolate some individuals so they can get more attention.
Mayor, we saw out in California they have a shelter in place for a number of areas up in the Northern California region. Is there under any circumstances that could lead to something of that nature happening in Southeast Michigan or in Detroit, like a mandatory shelter in place type scenario?
Sorry, with respect to homeless individuals or with respect to?
In general, for the mayor in general.
Okay, I guess I could speak a little bit to homeless individuals and then obviously so I think what we have to get a better understanding of what's going on, and I think we want to let data drive our response. If we find out that there's very few or almost no people with fevers in any of our shelters, that might require one response. If we identify one place that has a few people, that might require a different one. I don't want to presuppose what the answer would be. I think we got to go on the basis of evidence that we get, but we're now in the evidence gathering process, at least as it pertains to homelessness.
Yeah. So we'll see. We're about 4 or 5 weeks behind California. We're evaluating that. But the other point I'd make is there is a shelter bed today for everybody who wants one. So we have people who choose for a number of reasons not to use them, but those resources are there. And if you know somebody, there is a bed open tonight for everybody. Any other questions? Good.
More on the shelters. If you were to identify somebody in the shelter, you're already concerned about beds.
Mm-hmm.
What kind of things can you do to mitigate the spread inside of the shelter? And then what happens to that person or persons if they've been identified?
Okay, so if we were to find someone tonight who has a fever, we've got a place that we can take them where there's currently has medical staff where they can be isolated and separated from other people who might have been in that shelter tonight. That's number one. Number two, we're going to be there's going to be a fever check for everybody in that shelter that that person might have been. And there's going to be personal protection equipment for people who are at that shelter, so they might be able to, for example, the most important thing to do is to say, hey, if there's a new person who hasn't been in the shelter, wasn't there earlier, we can make sure that they don't have a fever now. And of course, I want to just repeat the things that everybody up here says all the time. We've spent the first webinar going through every detail of a health protocol related to hand washing, wiping down surfaces, all the things you've heard the mayor and Director Fair talk about every day. They've been doing those things for at least a week on the basis of health notices that we've been sending them. So we expect them to continue to do that now with additional PPE and with the benefit of having the sort of testing and the capacity to isolate, which they didn't have before.
All right?
Before you go, can we get the correct spelling of both of your names and your titles, please, for people back in
Go
the
ahead.
station?
Arthur Jemison, Jemison. The Arthur part, I think, is probably. I'm the Group Executive for Planning, Housing, and Development, and Acting Planning Director.
Denise Fair, that's DENISE, F as in Frank, AIR, Chief Public Health Officer for the Detroit Health Department.
Mr. Mayor, before we go, can you give us an update on the integration of the recreation center workers with Detroit Public Schools employees and how they're going to get food out to these kids who are not in school now?
We're going to have that tomorrow, and so they were halfway through the plan today, and Alexis walked out of the room, but it'll be finalized tomorrow. They're asking about your food program, but I told them you would be ready to talk about it tomorrow.
Yeah, so we've got everything pretty much laid out. I just want the mayor to hear what we're doing, but we're excited about it.
And are kids being fed today? or
So,
is that-
so the DPS is setting up the grab-and-go starting Wednesday for the children. The question became, what about the parents of those children? Because, of course, the school lunch is only for the child himself or herself. And so our question was, how do we get food to the rest of the needy families? And the recreation center employees will be working on food for the rest of the families. But DPS has got the program for the children, I think, very well organized.
And where do we stand in terms of cases in the city of Detroit and whether or not any city workers have been afflicted?
I am not aware of any city worker who has come back positive, but this doesn't really mean that much right now. We spent the afternoon here with most of the CEOs of the major hospital systems, and the state's only testing 100, 125 people a day. We should be testing 2,000 or 3,000 a day. But the lack of testing equipment in this country and supplies is making those numbers not mean very much. You see there's 53 people tested positive in Michigan. The number is dramatically higher than that. And so we know we got a whole lot more people. But as far as I know, nobody in the city of Detroit has been tested. But the reality is the state is testing 120 a day and finding 20 a day positive statewide. And so we are taking every precaution because we know the coronavirus is far more prevalent than those numbers would indicate.
Governor Pritzker was pretty outspoken over the weekend, blaming the federal government for delays and problems like that. Are you ready to join?
I was enormously frustrated today as I talked to these hospital CEOs, many of whom were my colleagues some years ago. I've never seen them that frustrated. But to a large extent, we're flying blind because we don't know which of our citizens have the virus and which don't. If you look, and you can go on the state's website, they'll show you the testing numbers. 5 out of 6 tests are negative. So if this were being done properly, we'd be testing 2,000 or 3,000 people a day. We would know who the COVID-19 patients were. We would separate them quickly. And it's very hard for me to get my mind around the fact that South Korea executed this beautifully, testing 12,000 people a day, and knocked the pandemic down very quickly. But I would love, and I know that my colleagues in Wayne, Oakland, and Macomb County would love to have large-scale drive-up testing sites at the state fairgrounds and other sites. But there's no point in taking people's swabs if nobody can process the tests. And we're probably 2 or 3 weeks away from having enough testing capacity to justify setting up the regional testing sites. And so there's no doubt that this is a problem, and it is not getting solved. But I know the governor is all over getting the testing resources. And what I learned today is places where it started, the state of Washington, California, New York, where it hit first, as you can understand, they got the equipment and the supplies first. The other states, and this is why Mayor Pritzker or Governor Pritzker is so angry, the states that are coming in later are finding even a greater shortage. We should have a lot more tools to fight this. And a big part of why the governor has to close down restaurants and send people home is we're largely flying blind because we don't know which of our fellow citizens have the disease.
And where's the fall?
Yeah, well, there's no doubt about it. The country was not prepared. There's no doubt about that at all. And I'm not sure that the federal health officials would dispute that. But right now, we've got to get it fixed, and every hospital system in this region is right now pushing for more supplies and more equipment because the state lab has been doing all the testing. They're doing a great job, but they were never intended to be the lab for the entire healthcare system. And we need to get our hospital systems with their own labs. When that starts to happen, you're going to see the number of positive COVID-19 cases go way up. And that's going to be a good thing. It's going to mean we're finally doing what we should be doing. And I hope the media, when these tests start to come in and these numbers go up, start to understand it isn't because the virus is just spreading, it's because the testing is finally getting to the level it's going to be. But I think it's going to be 2 or 3 weeks before we start to see the level of testing we need.
So I don't want to put words in your mouth, but it sounds like you put the blame at the.
Yeah,
Perhaps the president?
so I'm not going to get into the name calling, but there's no question. The federal government did not have the states with the testing equipment or resources that they needed. And the amount of conversation I heard today over just the personal protection equipment out of the hospitals was surprising. But we got great leadership for the hospital systems. We came together with a group, a number of strategies, and we're going to keep talking. We got great people running our hospitals. We just got to get them some resources.
And before you go, apparently you're not going to be the next vice president since Vice President Biden said he would.
Oh, I thought you meant because Trump wasn't going to take me. Oh, go ahead, okay.
Maybe
Yeah.
Pence is going to take the throne full-time and you get a call. But have you had a chance to speak to Vice President Biden about what we're experiencing here in Detroit? Has he
Oh,
told you
yeah.
at all?
I spent 48 hours straight with him. So we had a lot of conversations, and obviously I feel very good about where his campaign stands and very proud of the way he's handling himself.
When's it time for his opponents?
Yeah, it's not my place to say. You're going to try to get me in trouble with everybody today, Abel.
Well, it's still early.
All right. All right. Anybody want to talk about something that's not trying to get me in trouble? All right. Thank you all very much.
From the police chief and the fire commissioner about how exactly they're making sure that our public, first responders
Yeah.
don't come into contact,
Yeah.
they're adequately prepared if they do come in contact with someone.
Yeah, there's no question. This is the thing that you have to understand about police, fire, and EMTs. They face communicable diseases in their job every day. They don't know when they meet somebody, do they have pneumonia, do they have tuberculosis, do they have HIV, do they have the flu? And so the heroism that they exhibit is an everyday thing. And so we've had this policy, and we will continue to have this policy, that any one of our first responders who interacts with somebody who is believed might have COVID-19, we will quarantine them until those test results come back. But our first responders are doing a great job, and they always face these risks. It just should be a reminder to all of us what they mean to us.
Anything specifically be put in place as far as how they are to respond,
Yeah, good.
protective gear, et cetera?
Yeah, they have all of those protocols, but they've always had those protocols. So, as I say, you guys are covering communicable disease like it just happened. They live with it every day, year in and year out. And if you talk to Commissioner Jones or Chief Craig, they can take you through the details, but they're very well prepared.
Is anyone in quarantine right now as a first responder?
I think we've got 5 or 6 people in the city between a couple of different departments who are in the short-term quarantine till we're waiting for test results. And unfortunately, test results, as I said before, the lab is so limited. I'm not aware of a single person who's in the 14-day quarantine for it being confirmed, do we? No, so nobody is yet in the 14-day quarantine.
But that's throughout the entire city
Right.
workforce, not necessarily first responders.
Right, it's first responders and we've got somebody in another department.
Speaking of that slow lab time, is there any, I mean, I'm sure the city and the state are doing everything we can to increase that, but what other sort of things can we do to, or like, what is in the power of the
Right.
city to try to?
So I've learned more about the Roche 6800 testing equipment than I wanted to know. And the governor is now all over trying to get our hospital systems the latest equipment. So apparently, this has been prioritized to the coronavirus hotspots in the country, which up until now has not been Michigan. But I know the governor is, as of this afternoon, working on that. But that's the kind of stuff we're talking about. We need to get reagents into the hospital's hands. So even if you have the equipment, you need the reagent to do the test. And there's a shortage of that. I could talk about this until you don't want to hear anymore. But they may sound boring, but if we could be doing 2,000 or 3,000 tests a day right now, we could knock this pandemic down. And we need to get to that point. All right, you probably got me in trouble enough. Thank you very much.